Welcome back to Project Independence in You on 88.1 and WCWP.org. I'm Rebecca Miller, your host, along with Otto Los, the co-host, and Christina Liu, our radio show producer of Project Independence in You. And now we are at the Talk of the Town segment. But Christina, I just have to say, again, I think I say this every single show, again, another great guest, so informative and really, really good suggestions. And, I couldn't help but think of the orthopedic doctor that was on talking about, the last show, his relationship with his patients and how, when you have a good relationship with your doctor, it just makes everything different. You can ask any question and, especially about any kind of, medication or questions. Like when I when I was going to the cardiologist about the cholesterol and all that, and then I went to my doctor who I could talk to, and I'm just like, I don't doubt my cardiologist. He's terrific. But like Danielle was saying, they are aggressive. Cardiologists are very, that's what they do. That's their field. They are. And, I was able to talk to my doctor and have a conversation about it. And, he kind of, not that he agreed with me, but he kind of quashed some of my concerns. And so important, basically.
No, it boils down to, which is a topic we've been talking about for years within Project Independence and obviously on the show, is, talking to your doctor or a medical person, and having those conversations. Because I feel so often, people look at a doctor tells them to do this, and you're like, okay, I'm doing it, whatever you say, I'm going to go do it. But, you had such a good point, because here you have two different doctors saying two different things, and it's so important to take that information and, obviously make the best decision, for yourself. And it also, what I was thinking, because I was thinking about my own self and family members, it's like, you take a medication and you're on this medication forever, right? You're just like, oh, well, I was prescribed it, so I'm just going to roll with, taking it forever and ever and ever.
Right.
It's so important to really, get it reevaluated, because, you very well might not need it. Look at what Otto's situation. If he didn't, wonder like, hey, why am I having this? And kind of did his own little research and then asked that question. Obviously, we're not recommending ever just stuffing saying cold turkey and saying like, all right, well, I guess I don't need this anymore, but the dosage can be changed. And I even know, and I'm even, I have a lot of friends and family members who are on things for different mental health prescriptions, and that is something that is constantly having to be, reevaluated and checked on and whatnot. And something like that is so important, because like I said, I've seen people who have had too much and are zonked, so it's just something that is so important to just keep your eye on. And listen, no one knows their own body and how things change than yourself, so just keeping those things on and just reevaluating.
Well, I think what it comes down to is medicine is not an exact science.
Mm-hmm.
And in some cases, maybe there are a lot more down to the nitty gritty than in other cases, but there's a lot of pieces that go into the puzzle, and the doctor needs help with those pieces. If you don't tell them what's going on, you're part of the puzzle. You are the puzzle. And if you don't tell the doctor what's going on with your part of the puzzle, how will the doctor be able to help you?
No, and so, and even what Danielle was saying about the, over-the-counter stuff, because, I think a lot of times, and I've even been guilty of it too, it's like, oh, well, it's over the counter, let me just pop it, like you're not even thinking, well, that could be interacting with A, B, C, and D things that I'm on, so it's so important to really have that full picture, and I'm a firm believer also, which is there's one golden nugget I can really get out there, is having that list of medications on you and having it updated. You make a little one for your wallet, and they have all different kinds of cards and stuff. And I know our Project Independent social workers were even helping seniors kind of get that together. It looks like Otto, I'm on the video, anyone who's listening on the radio, Otto is whipping out his very organized list of medications, which I would never think otherwise, Otto. But, it's so important to change those things. I remember having these conversations with John, and he was constantly being prescribed different things, over the years for his cancer treatments. And it was just, it could just grow and grow and grow. And, so it's so important to really, as soon as something changes on your list, to reevaluate. For my grandfather, he was on so many different things and so many different dosage and times. And my mom and I remember, like, we just like sat down, and like every so often we would sit there and just update that, because we all know when you're go to the doctor, or God forbid you have to go to the hospital for some reason, they say, what medications are you on, or so and so on, and you're in this like panic, like, oh my God, like what are, so it just makes life so much easier just for you, and just to get a quick, snapshot of these things. And listen, and if God forbid you're unresponsive, to for someone to be able to just look in your wallet and see, okay, you got this card that tells what you use. It's just so
One of the
important.
things we didn't have time to get into really at all, and we could do a show on it by itself, is this medication management. Medication management includes a lot of things, not the least of which is somebody who's home by themselves, and they now have to take this medication, and maybe they have a cognitive problem or
Right.
some other kind of problem. How do you manage giving them or making sure that they have a simple tool to help them take the medication? And even then, it's not easy. But
No, it's
that
listen,
whole topic is very
it's
complicated.
very complicated, and it's a great point that you brought up. And listen, I mean, they all, there's so many different contraptions, and like I'm speaking from experience, when we were dealing with my grandfather, later in life he had, aides that would come in and help with the medication kind of things. But prior to that, it was such a process, setting up those little, Monday through Friday, AM, PM kind of medicine, little, things to keep it as simple as possible. But I even laugh at my own mom, because I'm always yelling at her, because, she'll do that. And listen, my mom's fully functional, working still, but just her brain is just cluttered with so much stress and worry and preoccupation half the time, that, she'll be like, oh, I forgot to take, Monday's medicine, because she'll see in her little pill thing that's full, So that's hard, because as you're saying, if someone has cognitive things, they're not necessarily remembering to even go to that, thing, so it's
Well, and
very
let's add to that. Your mother lives in the same house as you,
right.
but let's add to that you live in Portland, Oregon, and your mother has some problems,
Yep.
which thank God she doesn't. But suppose she did,
Mhm.
and she's by herself, and you're like the caregiver from
Mhm.
Portland, Oregon. How do you manage that? How do you
Yeah.
know?
But and I think, that's a huge point. Listen, at Project Independence, we deal with these things, and in a couple of weeks when we have these technology show on about Alexa and those kind of things, kind of setting alerts and reminders, is really a piece of it, and it's really navigating how to do that. There are so many different things out there, but medication management is something also that PI social worker nurses are very involved with. There's a lot of times that, a senior will call our nurse, and the nurse will help and really be like the middleman between the pharmacy or, the doctor or whatnot. So it's I want people to realize that they could do that. Call 311 or 516-869-6311 for all that stuff. It's complicated, Otto. It's hard out here till,
It's a tough world.
survive daily.
I think part of it is that it's easy to get overwhelmed um, when you get involved with things like this, um, between the medication and setting up doctor's appointments like every other week, and this doctor and that MRI and this and that and whatever. A lot of people really need help and in managing that whole medical process, if you will. And I encourage people to reach out if they are on their own. Reach out, get help from Project Independence or uh, a friend, a neighbor, if you don't have the good fortune of having family nearby. Um, you really have to reach out, because it can take you over. It's complicated.
It's overwhelming, as you said, and we're talking for the most, together, listen, we say on the show all the time about how organized you are in different, aspects of your life. And certainly in this medical by the list you just pulled out, is very organized. But even for you, it's something that you have to really, work on and wrap your head around and understand, because it is so complicated, all these different things, and it is important to, Rebecca brought up numerous times, is to be your own advocate. And that doesn't come easy for a lot of people, and it's just, I think, once you kind of get into the groove of it and really start doing it, it becomes a little easier for you, to stay on top of these things and to be in the circle. But, I was thinking too, like with a pharmacist, obviously it's great if you can get there in person and talk to them and, bring your medicines or bottles or whatever it might be. But, I'm sure a lot of these over the phone, like let's say you're to CVS, whatever, pharmacy you're dealing with, to just call them and ask these questions and whatnot. So it's,
You just said something that I didn't really think about, but to be an advocate for yourself is work.
yeah,
It's work, all right? And I do believe that probably some people don't want to do the work. So therefore they kind of say, okay, whatever it is, it is. That's an approach. And that's a
right.
decision you
Mhm.
make in your life, that that's how I'm going to do it. So we're not saying that everybody has to go the other way, all
Yeah.
right? But I am saying that people who have the wherewithal and are willing to put the work in, it can't do you any harm to be much more of an active player in your situation. I mean, I know a lot of people that are not going to do it,
Yeah,
no
and
matter
that's why,
what.
and like it's a personality thing, right? And it's what,
Yeah, and that's a decision.
right? Absolutely.
Like John used to say, if you're not going to do it, that's a decision.
Yeah.
You made you made a choice, and that's it.
Yep.
It's unfortunately a little bit like, and we're not going to get into opinions on this, but people who decide they don't want a vaccine, they made a decision.
Yeah, and
And
like, and everyone should be able to make and that's the point of
y-
the show, right? Everyone's decision is everyone's decision,
yeah,
and
but
I
if
think,
that decision leads to you having
right, but that's your
having
choice,
problem,
right? We're
that's
humans, and
part
that's your
of the
choice.
process of you making that decision.
Yeah, absolutely. And I
You know,
think that it's just like we said, we're just here to, educate people, and I think this all taps into, the circle of support as well. This is all into that world of kind of planning and thinking and being, an active member of, your life, and what kind of steps to do in what situation and whatnot. So it's, but Danielle
y-
is wonderful. And Project Independence, we work very closely with St. John's in a lot of these things. And we just had, in November, we offered those phone appointments where you got to call up and have your list of medications, and they would help you kind of choose which Medicare, Part D program is best for you. So there's a lot of great things, and we hope to hopefully have these brown bag events again when we get all this COVID stuff in control. So it's just, the best thing I could advocate for people is to just, have that list. And then this way, that's a good starting point. It's easy enough to have that list, and just, this way it's easier for these different medical people to, do it with you. So,
you brought up one of my favorite topics is the circle of support. Which people can get by calling 311, and they can get a booklet, which is an outline for a circle of support, which could be used to think about what is your circle of
right.
support.
It's like a good worksheet. I was like,
Yeah.
I always think about that with the circle of support. You might have other things you want to add to it, or whatever your own personal situation is, but I think it's a good starting point, to kind of just think about these things. And I always want people to know, because it can be overwhelming, to, I think that's why a lot of people don't do certain things, it's because it's a big task, because you're like, oh my God, here's this document. If I can't fill out every, line, I somehow, like, my life is, in chaos. And but I want people to take it more as it's something to, like, for you to look at and, okay, you know what? Have a gap in this area. So let me just think of different possibilities. Maybe I can call the PI, social worker, or nurse, and get help filling in that gap. Even like, let's for example, with the snowstorm that just happened. Was it last week? I don't even know. My days are all messed up. Maybe it was last week. Maybe it wasn't.
Last
Um,
weekend.
well, it was last, right? Okay.
No, it was a
Um,
week ago, Wednesday or Thursday. A week ago,
yes.
Thursday.
Okay. Yes, because I think we
Yeah,
had snow last Friday when we were doing the
yeah,
show,
right.
right? We're right.
No bowling. That's what I remember.
There we go. So, um, but for that, and I've been working with project dependents for many, many years, and this snow removal issue always causes a panic situation. Unfortunately, there's been programs in the past, but it's a very difficult thing to navigate because there's so many factors, right? People aren't volunteering and then kids aren't doing it because they can't get it. There's a whole host of reasons why it's very hard. So we always tell people, it's really in your best interest to kind of prepare before the snowstorm hits, right? So if you have a landscape company, discuss with them and set up ahead of time, for them to come. Or if you have a neighbor that looks like, they'll keep it on, I mean, there's like, whatever it is, it's just thinking about it before the snowstorm hits, because inevitably there's the people that fully panic and say like, I'm trapped in, and it's hard to figure out how to do that at that point. So, it's really in all aspects, just kind of getting those things in order. So this way it alleviates so much stress, having that situated.
Just a thought on that one, by the way. I have the good fortune of having neighbors on both sides that are super helpful. And they have snow blowers, snow throwers, whatever you want to call it. And it really doesn't take them very long to shoot up and down your sidewalk and the path to your front door. So if there are people out there who happen to be on the other side of the spectrum, who have the right equipment, think about going a little further. It may take you another 5 minutes to do the sidewalk next door and some of the driveway or whatever. It would be very helpful to do that.
It's true. And it boils down to what we always say about like, neighbors helping neighbors kind of situation. Because you're right. It can take, such a short, and my husband, he works for a school district. So unfortunately, I had to be the shoveler, while he was at work, because he does, the plowing and snow stuff for the schools. So by the time he gets home, it's late, but I love that he still will help out the neighbor. He'll say, it'll be like, I'm like, what are you doing? What is this guy doing? And he's just, it's because it takes him. He's like, it took me no time to do it, and it is important. And I like that you mentioned that, because it's just a little reminder that people have, you might know someone on your block who it's not easy. And let me tell you, it's not easy to
well, the people next door have two young girls, about 12 and 9 or 10, and they actually came and cleaned off the cars.
Well, on that note, Otto, we just got it. We are going into another break. We'll be back here at Project Independence and You Community Talk Radio on WCWP 88.1 FM.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Back to Project Independence in You, 88.1 FM and WCWP.org. Rebecca Miller, along with Otto Los and Kristina Lou. This is the talk of the town, what's going on in North Hempstead. So what is going on? I know, Otto, you were asking about one of the articles that Kristina provides. Kristina gives us this huge packet of information that is completely impossible to read in a week. I mean, it's so much stuff, everything that's going on in the town, any kind of backup material needed. So, Otto, you had a question
well,
about...
There was a new one I noticed in there called What's Your Climate Story? And I was curious as to what was that all about?
Yeah, so it's a new program that they're offering. It's a free workshop that's going to be offered by the town. And it's really about getting the public out there to spread information, to reduce, greenhouse gas emissions and just kind of whatever's going on with this crazy climate and just understanding it. So it's going to be via Zoom on January 26th at 6:30 p.m. It's for all North Hempstead residents, and you're actually to get a certificate of participation after it. So it should be interesting. It's certainly a complicated topic.
Yeah.
But I encourage people to, if you're interested, to check it out and see. In North Hempstead, that's something that has always been really part of, planning and whatnot. There's so many different programs, whether it's, we loved our recycling back when we did
Yeah.
that interview about all the complicated things of recycling.
When we had SWAMA, yes.
Right, and then composting workshops they have, and they have, rainwater recycling. There's so many different elements and workshops that North Hempstead provides, and I think this is just another example of it. So if you're interested in that, you could certainly call 311 or 516-869-6311 for more information on that as well.
Yeah, I mean, to say the town is environmentally conscious is an understatement. They really do a lot of stuff.
Well, between the goats and the quails
right.
And what was the bats?
Yep, there was bats, goats,
Yeah.
and quails. That's right. It's like a Disney movie over here at North Hempstead. It's really
all parts of nature used to contain nature.
Yeah, listen, I'm in it. I support it. I'm very into all of it. Next week, I want to remind people that we're going to be discussing the topic of the importance of sleep, which is certainly something I think all of us can benefit from. So that should be really wonderful. And then the following week, we have on United Way to talk about Project Warmth, which is certainly a timely topic because things have certainly gotten very cold around here. So those are great. That's January. I really encourage everyone to tune in. If you have missed a live episode, you can always check our Project Independence website or the WCWP Studios YouTube page for past interviews. And then you can watch us on North Hempstead TV, which is great. I actually heard Shari, our mobility manager, was on the phone with someone yesterday, I think it was. And I heard the seniors saying like, "Oh, I was watching you on North Hempstead TV," So it was it was really just nice to hear about that. So I also want to remind people that we have a lot of programs that are going on. Some are through Zoom still, some are in person. So it changes. So I just always want to remind everyone to call 311 just to double check, about these different things, because sometimes it might be remote, sometimes it might be in person, but it could switch around and whatnot. We're in an evolving time. But I will go into that, but I just actually have this other paper in front of me that is very near and dear to my heart because I have been working on our end of the year stats.
Wow.
And it was quite amazing, especially for the fact that, you always think, oh, well, we've been in a pandemic, things have slowed a little bit, but not. It's kind of been the opposite over at Project Independence. So in 2021, I just want people to know there were 26,892 service requests that came into the town. Now, that was a 26.27% increase from the previous year, which was, I was like blown away by that because it's just staggering the amount of service requests that come into us. And Project Independence receives 43% of all the SRs created in all departments in North Hempstead.
So really just a little under half of all the SRs that came into the town of North Hempstead were for our little department.
Mm-hmm. No, and it's, right. We had touched upon it last week too. It's like because these service requests are just accounting for one thing, and all the services and all the dedication. This is my chance to really give a shout out to really the staff, the social workers, the nurses, all the DOSA staff, and then the people that we're partnered with, to refer. There's such a network and a community that goes on at Project Independence, and that's my favorite part of it, is that we've maintained, after all these years, still this grassroots kind of, boots on the ground connecting with different organizations out there. And it's just, it's really incredible. And
do those calls come in 5 days a week or 7 days a week or?
Yeah, 7 days a week.
7 days a week.
7 days a week. I mean, obviously we're not working on the weekend. So on Monday, it's always fun because you'll open up that and you'll see all the, requests that came in through the weekend. But yeah.
Well, if you do 300 days a year, it's about 86 calls a day.
All right.
A lot of calls.
Much lighter on the weekend.
Yeah.
But, 311 is open 7 days a
So,
week.
so theoretically, you may have like 100 calls a day
Yeah.
Oh yeah.
during the week.
Absolutely,
Yeah.
I can see, and that's just what's coming in through the SR system. You know, there's a whole nother stream of things that come in from cases that, you know, someone already has an established relationship with a social worker or a nurse, and they might be calling them directly, you know, or something on their office
Right.
phone. So
Like
there's a whole,
right.
or people
like
just coming into the office, frankly.
Yeah.
You know,
social workers will do a check-in call on someone. So that's going in. It might eventually go into the system, but
right.
it's separate from the call. And the other thing too is if somebody's calling for a a taxi pickup, 311 handles it. They get the caller's name, their home address, where they're going. If it's a return trip, they put all that into the system, and then that creates an email that goes directly to the taxi company that's in that region. So that whole thing could take 2 to 3 minutes if it all flows nice.
Right.
So, there's a lot of things that we
there's
do.
a lot of moving parts.
Right. So
you know,
that's just for a taxi call. You know, and it's so different than if an SR comes in for a callback for a social worker for a mental health issue or, you know, some kind of issue, because then they could be on the phone with that person for an hour, you know, 45 minutes. So it's it's hard to kind of measure just by saying that one SR could mean, you know, a 5-minute quick reservation.
It is, you know, and that's why, you know, we're always trying to find different ways to, you know, kind of grasp.
Well, it could I'm sure it leads to a lot of other outgoing calls where you may
Oh yeah,
call,
absolutely. And that's why, you know, we collect over at Project Defense. I want people to always understand this. You know, it's more than just a number, but it's, you know, we're constantly gathering in information. So whether it's one of our whatever program we're doing, it's not like, all right, cool, you know, here's our program, you know, check you got your gutters clean. It's such a monitoring program, you know, because we always want to make sure everything is smooth and things, you know, if they need to improve, how to improve them. You know, that's constantly going on with transportation as well. You know, it's reevaluating, all right, is this not working? You know, is there a problem with this? So there's a real communication that goes on with any service for Project Independence. You know, it's not you get the service and then check you're done. And so we get these monthly statistics from the social workers and nurses on top of all this, where they really go into depth on, you know, what specific services are going in, because this is how we gauge programming too, and what's really needed in the community. So just the social workers and nurses alone did, you know, we call them in the human service world units of service. And that's like the closest way we can kind of gauge, you know, how many services are provided. So that was 35,771 units of service. And that was just for 2021. The intakes and assessments that they did were 8,894. And the unduplicated amount of individuals that were served, it was 3,155. So these numbers are just absolutely, you know, I'm blown away when you know, I get that final tally after, you know, putting it all together. And it's just so amazing to just know the difference, especially during this time. And a time where you know, we haven't been able to really be out there or in the homes or not, you know, there's some in-person things, but they're scaled back to different things. To know that we're still having these connections with people in the community, I think makes Project Independence so incredibly special. And just in 2021, 618 new members joined. That was just, you know, in 2021 alone. So it's great to know that, and keep spreading the word. Tell your friend to join it, right? You know, that's the best way to kind of get our, you know, word of PI out there. So
we must be getting close to 16,000 members.
We are, and this year I'm assuming, you know, we'll hopefully get right, because we are at the end of 2021, we were at 15,725.
Wow.
New members. So I'm assuming, and you know, if things keep going the way they're going, you know, in 2022 we will hit that 16,000 mark, which is
yeah.
Do we have any idea how many people in North Hempstead are in the category of 60 and over?
Yeah,
so there's close to now, like just with the new census, it's about 60,000.
60?
Yeah, that's you know, kind of with the new census data and stuff that goes in. And our whole thing is, and we do a lot with the Pioneer newsletter, is how we reach, a lot of the larger community who might not be familiar with PI, and I laugh because I think sometimes there's people who are using PI that are not necessarily registered as a member, so there's every year we like to kind of clean that up and get a better sense of things. And, hopefully in this year too, we're going to update our mailing list for the Pioneer, because obviously we know that there's people are constantly turning 60 in the town. So, we've been working a lot on the back end of that stuff. So,
So
Otto, were
that's-
you calculating?
Yeah, I
the
was. It's
percentage?
about 27%.
Is that amazing?
Yeah,
Crazy.
of the
More than a
category.
quarter of the people in North
Mhm.
Hempstead are
Right.
60 and older. That is and that's going to grow every
Yep.
year. It's going to get bigger and bigger and bigger. According to AARP, there will be 60 and over will be the majority. Seniors will be
It's
60
taken
and
over. That silver tsunami is in full
That's
force
right.
still.
For two reasons. People are turning the baby boomers are all hitting their 60s eventually, very soon, and people are living so much longer. That's the silver tsunami.
Mhm.
It's the fact that people are living so much longer.
Right.
We've never had, this many people on the planet so I want to say old before. I'll be part of it very soon,
We'll say
It's
older, Beck. We'll keep it,
older.
we'll just put
Thank
the
Yeah,
you.
never
ER at the
old,
end.
always older.
That's right,
Right,
older.
exactly.
It sounds just more fun.
Exactly.
But, Beck, you had mentioned the transportation program, and that is a humongous part of PI, and especially during this pandemic time. I mean, how you guys all, and I've seen it, we're all in the office together, and especially Rebecca and Sherry working, hand in hand on, making sure things run smoothly and safely, because there was really this layer now of, really just trying to keep people safe, but able to get to, all different things, whether it was vaccine appointments. I mean, that was something that immediately the transportation program was being utilized for once the vaccine started rolling out. To pharmacists, there were so many, and obviously there's food shopping and whatnot as well. So just in 2021 alone, there was 31,052 rides provided under the PI transportation program. And since, we launched in 2009, the program, there was 355,668 rides, which is getting a mouthful. Our numbers are getting so high, I can't even process it. And I want to remind people too, our transportation program is not just for seniors. It's for, we do the disability transportation. So that's, 25 to 59.
21. Yeah, 21.
That's really amazing, and there was 162 different taxi rides were provided for just, disability.
Probably I'm sorry, but probably the equivalent of going from here to California and back again about a half a dozen times.
There you go. That's another way of looking at it.
I
Maybe
like
around the
it.
planet. Yeah.
That's a fun little thing.
A lot of
In
miles.
20 What's that?
A lot of miles.
A lot of miles. In 2021 also, we also took veterans to the Northport VA because they weren't providing transportation because
Great
of
point.
COVID. They couldn't use their buses. They couldn't get people in. So if a veteran had to get their vaccine at the Northport VA, we negotiated with our taxi companies, and they were all on board. And we didn't have a lot of riders because a lot of veterans actually, they have careers and they they haven't really depended on their veterans benefits, but there are a lot that do. So we were able to do that as well. So
and Beck, didn't the transportation program also travel to Belmont when there was vaccines going? So in that Elmont area?
There were so many kind of outside of North Hempstead areas that were providing vaccines that we opened it up. We did it within reason. I mean, we weren't going to the 5 towns,
right?
But something within Nassau County or even parts of Suffolk County, we did do. So we did extend it during that time, and we're reeling it back in now. But we actually have to take a quick break. You're listening to Project Independence in You on 88.1 FM and WCWP.org. Otto, we'll be right back.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence in You on 88.1 FM and WCWP.org, Community Talk Radio. I'm Rebecca Miller, your host for today, along with Otto Lost, co-host, and Kristina Lou, who is the radio show producer, pulls this program together every single week. I mean, guests are just great. This guest today, of course, we've had Danielle on numerous times, and she's actually done a lot of programming for our Project Independence members back in the day when, people were coming in, and she was helping out with the medication management brown bag program, and just so many, like, who used to say, who was the golden nugget person who always would come
Iris.
Iris. Mm-hmm. She had so many important points, and so much of it really had to do with communication. Mm-hmm. Communicating, constant communication with your doctor. Just, make sure you communicate with your doctor. No, you can pretty much ask your pharmacist anything when it comes down to your medication. I mean, they really can go. And the other thing is too, like, I've had times where I've had to call the pharmacist. I had a question, and they'll call the doctor. Like, they'll say, let me just call the doctor. I'll clarify. Right. Blah, blah, blah. So they, the doctors I think they'll pick up the phone a lot quicker for a pharmacist than they will for you calling about. And that's
why I always encourage people, to call 311, because I know our PI nurses do a lot of that, and,
right. Yes.
And they're very close with, even with Danielle as though, so they would pick up the phone and call Danielle and say, hey, Danielle, what's, so it's a streamlined kind of way to get these answers, which I think, we always say is our partnerships. I mean, I can't say it enough, the partnerships and through this radio show, it's not just, all right, we did, that was a great interview. We have this interview, now it's out there, our staff gets this information, and we kind of build our own network, and it just keeps getting bigger, and the resources, because listen, that is a huge part of PI, is having this network of resources, because obviously we're not directly providing all these services, nor should we, we're not trying to, reinvent the wheel. So it's always been such an important part of it. And I have to give a shout out to our, formal partners that we have, because they provide such amazing services. We have our TRI Help at Home program, and that provides light home maintenance, whether it's gutter cleaning. I mean, that's like the all-star service is the gutter. That's the most requests I get, because I track all of them. And so then there's light yard work, there's moving heavy items, there's window washing. And TRI obviously during this time was just doing outdoor work, for safety reasons and stuff. And that program, I just, we're all familiar with it, but anyone who's listening that might not be familiar with it, we are partnered with TRI, and the individuals have, different disabilities. And it's a work program. So it's a training program. So, but there's a supervisor that comes out with them, and, which is great, not so great for us, but great for what the program itself is, that a lot of these people go through the program, graduate, and get, a job in the field. So they're constantly trying to, get new people to be in the program, because it is so successful. And, we've had them on the radio show a bunch of times, because it's so rewarding for not only the senior receiving the services, but also the person who's, providing the services. There really becomes a wonderful kind of relationship. So,
right. And I think the seniors
but the expectations have to be set that are real, that they won't do gutters on the second floor.
No, nothing on the second floor. Exactly.
Right. And windows on the second floor.
Yeah, there's no ladders involved, so it's always first floor things. And the bottom line is you call 311, right? So let's say I'm a senior, I'm interested in, using the service. So you call 311, a service request will go to, the social worker in your area. The social worker will then call you, see what what you need around the house. Now, it might not be covered in that program. It might be better for rebuilding together, which I'll get into, or an outside agency. So I always encourage people to call, and then the social worker will tell you, all right, yes, they can do that in this program, that we provide that service through here or whatnot, because they're now our PI social worker is in direct contact with TRI and works with that supervisor, and then I'm involved. There's a lot of layers of monitoring and making sure things run smoothly. So, the program is completely free. As I said, there's limited services that are provided. I can tell you right now that the gutter cleaning on the first floor, as Otto had mentioned, is the most popular. And then there's a lot of seasonal requests, so it's a lot of, taking the AC, putting the AC in the window and taking the AC out of the window.
How are they handling that now with COVID? Has that?
They were just doing it from the outside.
Right. Okay.
Yeah, so they were able to do that from the outside.
Excellent.
Obviously, hopefully this year they'll be able to kind of do more in-home things, because another huge service that we take for granted was changing batteries in smoke detectors, or changing a light bulb, that might be high up. I mean, I think, it's things that you don't even think of. You take, oh, I'm going to change my light bulb, but this could really make or break someone's experience, and so they would, go in the house and do that. There's
such a great example, though, of, aging in place, here, and what a great partnership, for people with, disabilities, getting job training, to a senior's home who, they feel good about it. I think you would feel good about, helping
right,
that training process. And it's such a great partnership. It's really,
it's an incredible, and this year there was 70 different constituents received assistance, and since it started the program, there's been 1,464 seniors who've utilized the program, which is
that's amazing.
Let me ask you a question. If you have a scenario where you're somewhat limited to main level living, you're on the first floor, but you have stuff maybe in the basement or in your upstairs floor that you would like to get, maybe some clothing that you want to wear because it was in a closet or whatever, would they come in and do something like that?
So so there has been. It's I don't want to make a blanket statement that because it depends on a lot of different factors. Just recently, someone had called because they had a giant armoire that they needed, removed from the upstairs, and they wanted to actually just to get rid of it, but it was too cumbersome and heavy. So that was something out of the purview of TRI. They don't have the manpower to do those things. But I always encourage people to call 311, because just to ask that question, because they might, our social workers and nurses, on top of just what we're, directly partnered with in PI, have other resources or people they know, and there's communication between them. And a lot of times they'll be like, hey, do you know, who could do something like this? So just always call. We're never going to be like, sorry, you're out of luck. It's been real. But so that is the TRI program. And that's, like I said, it's very lights up. I want people to be clear. It's not, we've had some calls, the people want a full, fall cleanup, spring cleanup on their front lawn. They're not going to do something like that, so it's really, we've narrowed it down to kind of some basic things that really are important to, staying at home. Now we have rebuilding together also, that is part of our home maintenance kind of thing. And that's more complicated jobs. It's also income based. And throughout this year, when the COVID numbers were kind of decreasing a little bit, they started going in the homes again. And they had their own kind of checklist of different things that you needed to follow. But, a huge part of what they did this year was grab bars, railings, and various repairs that really impacted people living, and safety concerns. That's how they judge things. Well, we've gotten calls that people kind of want some cosmetic things done. They're not going to do, cosmetic things. But if there is a broken tile, they will replace that tile, and there's, so that program we really we reevaluate constantly, and there's a lot of communication because we want to make sure that, you know, the resources we're allocating are being used for things that are safety concerns and, you know, people really need. But the amount of grab bars and railings that really make such a difference. You know, it's a little home modification that can completely change your living situation. So I want people to always be open to that and realize that. You know, I remember with my grandpa, that was something when we did that because it made such a difference. You know, he was struggling towards the end. I remember of getting, and we had transformed things into like a main level living situation for him. So the bed was there, but he had a very hard time pulling himself up, you know, from the bed. So my dad went in and my husband, and they went in and they put, you know, grab bars on the wall. We said, like, let's just do like a test run. Like, where would it be more beneficial to help you up, you know? And it made that huge difference, you know. And listen, in the bathroom, certainly it's so important. And then just railings outside, you know, a lot of our seniors had railings that, you know, might have been up there for quite some time. So, you know, to replace
They would
that.
not get involved with something like a walk-in shower, I assume.
No, yeah, obviously we're
Right.
not going to be able to do, you know, but
Right.
something, there are plenty of organizations out there that do those kind of things.
Right.
You know,
When
obviously
I
mostly for a cost.
started, right. When I first started with the town back in 2007 with Project Independence, we were working with United Way on access to home. And what we had to do was, you know, of course, we had to go into seniors' home who were willing to have us come in, and we had to kind of look around and see what were the things that we could do within reason. And, you know, it was really shocking. It was such a great education, though, Kristina and Otto. Like, I really never connected to that kind of thought process. Like, how do we make it safer? Like, what if you can't do modifications? Like, what if you don't have the money, or there's not a program that really fits? You know, you have a really great house, but it's you have throw rugs, you have lamps with cords, you're climbing on a chair to get something off the top shelf. You know, what we learned was, you know what? If you need a ladder for anything, remove that thing that you're getting the ladder for. Move everything down. Remove the opportunity to getting hurt. You know, get rid of your throw rugs. Get rid of any lamps and cords. And I mean, it could happen to anybody.
No, you're right. There are simple modifications that don't really cost you any, you know, if anything.
Right. Just,
you know,
being
to keep safety.
of, you know, your surroundings, and get rid of that. You know, Otto, I love that main level living. I thought I coined that phrase years and years ago, but maybe, you know, because I remember we would go in and you know, someone would be going down in the basement. It was back in the day. Remember, we just landlines were so big, heavy phones on the phone with the laundry basket, going down dangerous basement steps, and then coming up with the clothes. And it's like, oh God, you know, it just makes so much sense. That's another opportunity. And just kind of talking to them and saying, you know, hey, you know, this is like really dangerous because you live alone. What would you do? Yeah. And it's like, all of a sudden, it's like, you know, you're right. Like,
well, there are some things that people can think about. And I know some people are very stubborn about the idea, but maybe you don't have the perfect house for main level living. So then you can get a chair lift that goes up and down your steps and gives you the ability to ride up and down. And it's not that cost prohibitive.
You know, that was something that actually Rebuilding Together did assist with this year. And that also depends. So I never want to make a blanket statement because it's not our call. It's always Rebuilding's call about, you know, they'll evaluate if they're able to do it or not. So in this case, they were, because it was about removing an old chairlift, and the senior had, you know, a chairlift that they needed help installing, and Rebuilding was able to put that in.
Because it was existing already, right?
Well, laundry, there are services that will pick your laundry up and bring it back nicely folded, shirts on a hanger, which we do, frankly. I think in the long haul, it's not you don't have to buy any more Clorox or soap, or you don't have to go down to the basement, which maybe you don't go down to for any other reason. You know, it's worthy of looking into. Yeah, there's a lot of ways you can kind of make yourself.
No, you're so right. And I think that,
Yep.
it's something obviously every person has to come to terms with what they're willing to, you know, do or not do or pay for or not pay for, but it's a great point because there are these services out there and we're very lucky. We live in an area that there are a lot of these, luxury kind of, things that make life a little easier. Yes, they might cost, a fee, but you're right, Otto, because listen, the amount of money I'm over here that I spend on, fabric softener, Clorox, the regular
By
thing.
the time you're done, right?
And it's, that adds up, and that's a great
Yeah.
point. So that you're taking away that cost, you're taking away the water bill that, that is part of it. And just the safety thing, because you're so right. It's listen, I'm very lucky that my washer and dryer is right here, behind this door. So it's all, and I'm young, but it's quite convenient. I could only imagine schlepping down basement steps, because I think about my grandparents' basements and they were always quite the rickety steps as well. The handle was, the railing was always kind of like loose, and it's these things that can really cause a complete disaster. But, the Rebuilding Together program, the Help at Home program, yes, they don't provide every service, but they really can help. And you're able to, what's great too is if the job is bigger, Rebuilding Together, is all retired volunteers. Most of them have worked in the kind of contracting, plumbing, home renovation world in the past.
I love that. And these are retired.
That's what,
and they're
that's what makes
volunteering.
them
They're
amazing.
another wonderful partnership. I mean, how, you have these retired people who are now volunteering to help, people get whatever work.
And if the job is too big too, a lot of times they know places things can be referred to, so it's you're getting connected to that, and it's so special. And for both these programs, the senior has to fill out a survey, so we just make sure everything is good before anything goes on. And just to see, especially in Rebuilding Together, the difference that this program makes for someone is so incredible. And it's from their children, we'll get comments from. So it's really just amazing. And I want people to know that these services are out there. They're still out there for 2022. You can call and do that as well. So it's,
I'm sitting here listening to what we're talking about, and I'm thinking to myself, some people probably are skeptical because they think this is too good to be true. Right? Yeah, truthfully, but it is. These are free advice that you can get from people who know what they're doing about all kinds of things.
Mhm.
So the doors can be open to many, many different benefits that wouldn't cost you a penny. And it's a free service via the Town of North Hempstead.
Mhm.
It's
Project
not
Independence.
there's no hidden little agenda in here where they're
There's
trying
not.
to get you to sign a contract or
Yes, you do not need to sign any
that's not the
contract.
case.
No, and that's what you're right, Otto, because we have tried certain programs in the past, obviously, because there are bigger issues, that go on with homes and stuff, and it does get a little complicated because some are, when you get involved in bigger renovations, there's permits involved, there's a whole layer of things, but with these two programs, we were able to find a way to provide, select, it's very narrow services, but they're so important too, and it's things, like I said, with these grab bars and railings, the difference that those things can make in your house for a very nominal fee, on the partnership side of things is just is really incredible. So
Kristina, we have just a few moments left, and I'm just wondering if there's anything else townwide going on that you wanted to mention.
So
or
right
what
now,
we're doing next week.
There's all the programs, obviously, that are going on virtually through Project Independence and the in-person. So there's social groups, there's community education chats that are going on. Our exercise are going to kick off in February. So you can currently register for those. We'll go more into detail next week on all the specifics of that and just all the stuff that's coming up.
Well, why don't you take it home?
Well, that has been a show, guys. Rebecca joined us. Thank you. I'm so happy you were able to join us today, Beck and Otto. Thank you to Dan, our Wizard of Oz behind there. And this has been Project Independent and You Community Talk Radio on 88.1 FM and WCWP.org. Tune in next week.